Did you know that approximately 1 in 40 adults in the United States suffer from obsessive-compulsive disorder, also known as OCD? Yes, you heard that right. A condition often misunderstood, OCD is a common, chronic, and long-lasting disorder that compels a person to perform certain routines repetitively. These routines, also known as compulsions, can be so severe that they significantly interfere with a person's daily activities and social interactions. Now let's put what we've just learned into perspective. Imagine being in a room full of 100 people. Statistically speaking, at least 2 of those individuals are likely to be struggling with OCD. Now consider the entire population of the United States. That's millions of people silently battling this condition every day. OCD doesn't discriminate. It affects men, women, and children of all ethnic and socioeconomic backgrounds equally. It's a disorder that can be debilitating, and if left untreated, can cause severe anxiety, depression, and in some cases, may even lead to suicidal thoughts. One of the most challenging aspects of OCD is that many people suffering from it often hide their symptoms due to fear of embarrassment or stigma. This means that the number of people actually living with OCD could be much higher than we currently estimate. It's a silent epidemic affecting more people than we realize. As we delve deeper into the topic, it's crucial to remember that OCD isn't about being overly neat or organized, as often portrayed in popular culture. It's a serious mental health condition that requires understanding, empathy, and most importantly, professional help. So why are we talking about this today? Because understanding is the first step towards acceptance and support. By shedding light on OCD, we hope to debunk the myths surrounding it and encourage individuals dealing with the disorder to seek help. That's a staggering number of individuals fighting an unseen battle every day. As we move forward, let's keep this fact in mind and extend our support to those around us. It's time to break the silence and start the conversation about OCD. So, what exactly is obsessive-compulsive disorder? Obsessive-compulsive disorder, or OCD, is a mental health condition that's often misunderstood. It's not about being a neat freak or liking things a certain way. It's about grappling with intrusive and persistent thoughts that lead to repetitive behaviors. At its core, OCD is characterized by 2 critical components: obsessions and compulsions. The obsessions are the uncontrollable, recurring thoughts that cause significant distress and anxiety. They're not just everyday worries about work or family. Instead, they're intense fears or thoughts that don't go away, no matter how much the person tries to ignore or suppress them. Imagine having a thought, an image, or an urge constantly playing in your mind, like a song you can't get out of your head. But instead of a catchy tune, it's a fear of contamination, a preoccupation with order and symmetry, or intrusive thoughts about harm coming to oneself or others. These obsessions are often disturbing and can interfere with a person's daily life. Then we have compulsions. These are the behaviors or rituals that individuals with OCD feel compelled to perform over and over again in response to their obsessions. It could be excessive hand washing, arranging items in a particular order, or repeatedly checking if the stove is off. These actions are often carried out in an attempt to ease the anxiety caused by the obsessions. However, the relief is temporary, and the individual is often fully aware that their behaviors are irrational, but they feel powerless to stop. It's like being stuck in a loop, where the obsessions fuel the compulsions, and the compulsions reinforce the obsessions. So OCD is not about being overly tidy or organized. It's a serious condition that traps individuals in a cycle of obsessions and compulsions, causing significant distress and impairing their ability to function in their daily lives. In other words, OCD traps individuals in a cycle of obsessions and compulsions. Now that we understand what obsessive-compulsive disorder is, let's identify the symptoms. OCD is characterized by a variety of symptoms, and these can differ greatly from person to person. However, there are some common symptoms that many people with OCD experience. One of the most recognized symptoms of OCD is excessive cleaning or hand washing. This isn't just about maintaining cleanliness or hygiene. Individuals with OCD may wash their hands so frequently and thoroughly that their skin becomes raw. Their fear of germs and contamination is so intense that no amount of cleaning feels enough. Then, there's the symptom of repeatedly checking things. This could be anything from repeatedly checking the door to ensure it's locked, to obsessively checking the stove to make sure it's turned off. People with OCD are often plagued with doubts and fears that they've left something undone, even when they know they've checked multiple times. Compulsive counting is another symptom that may seem peculiar to those unfamiliar with OCD. Some people with OCD feel an overwhelming need to count or order things in a certain way. They might count the steps they take, the number of times they chew their food, or even the number of words in a sentence. It's not about the numbers, but the feeling of unease that comes when the counting or ordering is interrupted or not right. Fear of contamination or a serious illness is also a common symptom of OCD. This goes beyond the typical worry about catching a cold or flu. For someone with OCD, the fear can be debilitating. They may avoid public places, refuse to touch certain objects, or constantly seek medical reassurance, all in an attempt to prevent coming into contact with germs or contracting a disease. These symptoms can significantly interfere with a person's daily activities and social interactions. Imagine feeling the need to wash your hands for 20 minutes before you can eat, or spending an hour each morning checking and rechecking that the front door is locked. These compulsions can take up a large part of the day, making it difficult to complete normal daily tasks or maintain relationships. It's important to note that many people without OCD can experience these behaviors to some degree. What sets OCD apart is the intensity and frequency of these behaviors and the distress they cause. For someone with OCD, these aren't just quirks or habits. They're compulsions that feel necessary to prevent something bad from happening. Recognizing these symptoms can be the first step towards understanding and helping someone with OCD. The more we understand about this complex disorder, the better equipped we are to offer support and empathy to those who are struggling. Remember, OCD is not a choice, it's a mental health condition that requires understanding, patience, and appropriate treatment. Imagine having a brain that won't turn off its alarm signals. That's what living with obsessive-compulsive disorder, or OCD, feels like. Living with OCD is not about being overly neat or liking things in a certain order. It's about dealing with intrusive thoughts that won't let go and engaging in repetitive behaviors to alleviate the distress these thoughts provoke. It's a constant cycle. An obsessive thought triggers anxiety, which is then temporarily relieved by a compulsive act. But relief is fleeting, and the cycle begins again. This disorder doesn't just affect a person's mind, it infiltrates their daily life. Imagine spending hours each day washing your hands, checking locks, or mentally reviewing conversations, unable to move on until you've completed these compulsions to your brain's satisfaction. This can be paralyzing and can significantly impact a person's ability to function in their everyday life. OCD can be debilitating, making it difficult for a person to hold a job, maintain relationships, or even leave their house. With their mind constantly filled with obsessions and compulsions, it can be tough to focus on anything else. This can lead to feelings of isolation, as the outside world seems to move on while they're stuck in their repetitive cycles. The constant stress and anxiety can also lead to physical health problems, such as headaches, stomach issues, and sleep disorders. Despite this, it's important to remember that OCD is not a personality quirk or a character flaw. It's a serious mental health disorder that requires treatment. And while it may feel like a constant battle, it's one that can be managed with the right help and support. People with OCD can lead fulfilling lives, but it often requires a commitment to treatment and self-care. This could mean therapy, medication, or a combination of both. It might also mean lifestyle changes like incorporating regular exercise, a healthy diet, or mindfulness practices to help manage stress and anxiety. But perhaps one of the most important aspects of living with OCD is understanding that it's okay to ask for help, understanding that it's not a sign of weakness to admit you're struggling, understanding that it's not your fault, and understanding that while OCD might be a part of your life, it doesn't have to define it. Remember, having OCD doesn't make you weak, crazy, or broken. It's just a part of your journey, a chapter in your story. And like any story, there are ups and downs. There are obstacles to overcome and victories to celebrate. And through it all, you're not alone. There are others out there who understand, who've been where you are, and who are ready to offer their support and encouragement. OCD is not a choice, nor a reflection of character. It's a disorder that people live with and manage every day. The journey may be challenging, but with understanding, treatment, and support, people with OCD can lead fulfilling, meaningful lives. Although OCD is a chronic disorder, it's not a life sentence. There are treatments available. Now that's a line that deserves to be repeated, isn't it? Because truly, there is hope, and there are ways to manage and even overcome OCD. One of the most common and effective treatments for obsessive-compulsive disorder is cognitive behavioral therapy, often abbreviated as CBT. This is a type of psychotherapy that helps individuals to change unhelpful patterns of thinking and behavior. In the context of OCD, the goal of CBT is to reduce the anxiety associated with obsessive thoughts and to help the individual resist compulsive behaviors. Within CBT, there's a specific technique called exposure and response prevention, or ERP. This involves gradually exposing a person to the thoughts, images, and situations that make them anxious and preventing the accompanying compulsive behavior. For example, if someone has a fear of germs, they may be gradually exposed to situations that they perceive as contaminated, all the while learning to resist the urge to wash their hands or engage in other cleaning behaviors. It's important to note that this process is gradual and carried out in a safe and controlled therapeutic environment. It's not about flooding the person with anxiety-provoking stimuli, but rather about helping them to confront and manage their fears in a healthy way. In addition to psychotherapy, medication can also be an effective part of OCD treatment. Certain types of antidepressants, known as selective serotonin reuptake inhibitors, or SSRIs, are often used to help manage the symptoms of OCD. These medications can help to reduce the frequency and intensity of obsessive thoughts and compulsive behaviors. But remember, treatment isn't a one-size-fits-all situation. What works well for one person may not work as well for another. It's essential to work with a healthcare provider to develop a treatment plan that is tailored to the individual's specific needs and symptoms. And perhaps most importantly, seeking help is key. OCD can be a debilitating condition, but with appropriate treatment, individuals with OCD can regain control over their lives. It's also crucial to remember that there's no shame in seeking help. Mental health is as important as physical health, and seeking help for mental health issues should be viewed no differently than seeking help for a physical ailment. So, if you or someone you know is struggling with OCD, reach out to a mental health professional. It may be a psychologist, psychiatrist, or a counselor. The journey towards recovery might not be easy, but it's definitely worth it. It's about gaining back control and living life on your own terms. Remember, there's no shame in seeking help. Treatment can provide relief and help individuals regain control over their life. So, take that first step. Reach out, ask for help, and start your journey towards managing OCD. You're not alone in this, and help is available. So, we've taken a journey to understand OCD, its symptoms, and treatments. Let's take a moment to reflect on what we've learned. Obsessive-Compulsive Disorder, or OCD, is more than just a tendency towards neatness or a quirky habit. It's a serious mental health condition that affects millions of individuals worldwide. We've talked about how the symptoms of OCD often include recurring, unwanted thoughts and rituals that can be incredibly distressing and time-consuming. These obsessions and compulsions can be about anything, from cleanliness and orderliness to fears of harm and intrusive thoughts. It's important to remember that these symptoms are not a choice, but a manifestation of the disorder. Living with OCD can be challenging, to say the least. It can affect every aspect of an individual's life, from their relationships and work to their sense of self. It's not just about being neat or organized. It's about dealing with intense anxiety and distress on a daily basis. But there's hope. We've discussed the various treatments available for OCD, including cognitive behavioral therapy, exposure and response prevention therapy, and medication. These treatments have been shown to be effective in managing symptoms and improving quality of life. However, treatment is just one piece of the puzzle. Understanding, empathy, and support from others can make a world of difference to someone living with OCD. By educating ourselves and others about OCD, we can help to fight the stigma often associated with mental health disorders. We can help to create a world where those with OCD feel seen, heard, and understood. In conclusion, OCD is a complex, often misunderstood disorder. But with education, understanding, and the right treatment, it's a condition that can be managed. Thank you for your time. Your understanding and empathy can make a world of difference to someone living with OCD. Don't forget to like this video and subscribe to our channel for more informative content. Together we can fight the stigma and support those living with OCD.